Hi, I'm Betsy Leyleitner, and I'm a licensed clinical social worker for Meritas Health at a primary care physician's office. And I'm here today with Dawn Rosie, who is also an LCSW for Meritas Health, and with Kelly Self, who is an RN care coordinator for the Meritas Health pediatric group. And today we will be discussing the topic of suicide prevention and awareness, just to give people resources if they have concerns about themselves or a family member. This is a topic that we see almost every day in our clinics here. And according to the studies by the Missouri Institute of Mental Health, Missouri is ranked 14th in the nation for the suicide rate, and 1 person every 8 hours commits suicide in the state of Missouri. So it's a very relevant topic for us. Dawn, what warning signs do you look for when you're working with adults in the clinic for suicide?
Well, with the adult population, we look for if there's a chronic illness, terminal illness, disability, as those patients in that category can tend to contemplate suicide a lot more. We also look at, are they talking about suicide? Are they having feelings of hopelessness or having feelings of not having any future? Do they feel trapped? Are they feeling like they're a burden to others? Do they increase their alcohol and drug consumptions? Are they having increased mood swings? Are they giving away their possessions? Are they showing any self-harming behaviors? Those are all symptoms that we would look at and take appropriate actions if we needed to.
And Kelly, what would be some different warning signs for parents to be on the lookout for with their adolescents or children?
Some different warning signs you might see in your teen or adolescent might be withdrawing from social situations that they typically would want to be a part of, change in their grades, increased anger, hostility, or aggression, as well as being intolerant to changes.
And Dawn, what are some resources in the community that people can use if they need to reach out for help with this?
One of the best resources that they have is their primary care doctor. The state of Missouri and all the states in general are taking more action on the suicide, that they are having clinicians, the doctors, do more depression screenings. So everybody that comes and sees their primary physician will get a depression screening. Depending on where they're at with the depression screening, if they're doing well and they just have some ups and downs, they'd be encouraged to contact friends, family, church members, community support members. If they're having some acute distress, but they're not really having a plan for suicide, they'd be encouraged to talk to some mental health professionals or counselors in the community. If they are in acute distress and they are feeling hopeless and they've got a plan and they've got the intent and they got the motivation, they would be recommended to call 911 or go to the emergency room for further evaluation.
And Kelly, what are some resources in the community for adolescents specifically for suicide?
It's always great to start with your primary care doctor or your child's pediatrician. There's a lot of providers in the Kansas City area who work specifically with adolescents and mental health, and your child's doctor would be able to kind of help direct that process. It's always important to be very direct with your teen when asking them. So asking questions like, do you feel depressed or do you want to harm yourselves, is very important to get the best answer from your teen. If they are actively suicidal or you're concerned about their immediate well-being, you can always call 911 or get them to the nearest emergency room.
Okay. Well, thank you, ladies, for being here today, and we just want to encourage you, if you have a concern for yourself or a family member or a friend, please reach out for help. We will also list these resources at the bottom of the screen in this video.